This is Corey Drinkett. We're going to talk about personal and professional development. This is chapter 24. With this chapter, we are going to explore aspects of personal and professional development in sterile processing. We're also going to focus on career growth, continuing education, professionalism, and leadership pathways that are essential to success in this vital healthcare role. Uh, pers- per- Personal and professional development is not just encouraged; it's also it's essential. This field is consistently evolving with new technologies, procedures, and standards. So a commitment to continual improvement ensures that we remain competent and confident in our role. It's also important to understand that development involves both personal attributes like communication skills, reliability, and ethical behavior, but it also includes professional growth, which includes acquiring knowledge, certification, and hands-on skills. When we focus on development, it doesn't just benefit our careers, it enhances the safety and efficiency of the entire department, contributing to better patient outcomes and a stronger healthcare team overall. Professional and personal development is an ongoing process that involves activity seeking opportunities to grow both personally and in our careers. As technicians, this can include learning new procedures, earning certifications, and improving communication and leadership skills. This development is crucial because it directly impacts patient safety and care quality. The more skilled and knowledgeable you are in this role, the more efficiency and accurately you can perform at your with your responsibility with the responsibilities that's entitled to you. This will also help foster a culture of accountability. It will also boost any type of morale, and it will open up doors for advancement. In a dynamic field like healthcare, staying current with standards and technologies ensures you are always prepared for change. That's one thing about the healthcare field. It's constantly changing no matter whether you like it or not. It's going to change. Um, I've been in this profession for a long time, and I've seen the changes that it's gone through. Um, Types of professional the development is essential for technicians is to stay current and competitive in the field. One of the types that is offered out there is called continuing education or CEs. This allows staff to stay informed about the latest best practices, equipment, and standards. You can get your CEs or CEUs on services that your facility offers, any online training that you might come across, or even any vendor provided courses that's out there. Um, Another type of professional development, and this is what you are working on now, is a professional certification. This helps validate a technician's knowledge and skills. So the certifications that's out there now that HSPA offers is the CRCST. This is what you're going for now. You're certified registered central sterile technician. There's a CIS, or your certified instrument specialist. There's a CHL, your certified healthcare leader. And there's also the CER, your certified endoscopic reading processing. Getting these certifications will show a commitment to excellence and are often required for advancement. Any type of networking opportunities, such as attending local or national conferences or joining associations like HSPA, help technicians connect with peers, share knowledge, and find mentorship. In Indiana, we have our own um, chat, chat chapter that puts on two conferences every year, one in the spring and one in the fall. HSPPA puts on a conference every year at different locations throughout the country. So this is where you can network. You can meet with people um, in the uh, in our field nationally, globally, and you can make friends too. You can see what other people are doing in other healthcares. To maybe it might help with what you might be going through. Cross training is another development which provides exposure to different departments or roles within SPD, enhancing adaptability and making employees more valuable to their departments. Career advance programs such as supervisory and leadership training or formal mentoring programs help technicians prepare for roles with greater responsibility. Encouraging these development pathways strengthens individuals and elevates the overall performance of the department. Sterile processing. We offer a structured career ladder with many opportunities for growth. Technicians can advance to lead roles, supervisory positions, or even up to director level leadership. Some choose to specialize in areas such as quality assurance or education, while others may work for medical equipment vendors or manufacturers. So planning your career is an essential step in professional and personal development. One of the first ways is to start by identifying your strengths, your interests, and the areas where you want to grow. Um, then you need to set clear, achievable short-term and long-term goals. Um, get your certifications. Get all three or all four of them. These can open doors to advancement. Just one thing you got to remember: the CHL, the Certified Healthcare Leadership. A lot of times to get into a leadership role like a supervisor or even a director or a manager and stuff like that, you also need extra schooling above that. Some want either an associate's degree or a bachelor's degree as well. So be mindful of that if you're going for your CHL. Continuous education, attending workshops, and staying informed about changes in technology and best practices are also key to succeed in this field. Resources are tools that empower technicians to stay informed, competent, and engaged in their roles. They also help us maintain an up-to-date, to be up to date with ever evolving industry standards, regulations, and best practices. Don't forget those things, they can change every year. And a lot of times they are reviewed every year or every two years. So you got to keep abreast about that too. Mutualizing resources such as professional associations like HSPA, online learning platforms, any type of pub, pub publications that you can get hands on. In these certification programs, all these can enhance your knowledge and contribute to improved departmental performance. Investing time in these tools not only supports job efficiency but also positions you as a technician, as a professional, for for promotions and long-term career success. Assessing and applying the right resources demonstrates a strong commitment to professional development and quality patient care. Uh, Developing a resume or a curriculum vitae is an essential part of pursuing career opportunities in sterile processing. A well-crafted resume presents your qualifications, your work history, and any skills that you consist of in a concise and organized way. Tailor each resume to the specific role you are applying for. So this shows employers that you understand their needs and are a good fit. You need to highlight your certifications. Any continuing education you've completed. Any training that's for whatever role you're going for. It should be up on that resume. B, to include any relevant experience in healthcare or sterile processing. Bullet points can help structure responsibilities and achievements clearly. Your contact information should be current, and a professional summary can give a quick snapshot of who you are and what you offer. Use language that is straightforward and focused. Don't use jargon. Don't use any abbreviations. Don't overly use any technical jargon as well, unless it is relevant to the position. You need to keep your layout clean and professional. So a resume is easy to read that stands out more than one that's cluttered or disorganized. Keep it simple. Um, don't put a lot of humor in it. Don't put a lot of words in it. Be truthful on your resume. Put it in chronological order as well. Just keep it clean. Keep it neat. Understanding the interview process. This can make a strong impression as well. One of the first things you want to do is research the employer and or the job that you're going for. So this will help tailor your responses and demonstrate your interest in the position. Next, you want to prepare for common interview questions and come up with a few thoughtful questions of your own to ask the interviewer. Um, with the questions, I always bring a pen and paper with me as well. I ask if I can take notes, because then I can come up with questions as well throughout the process, and then I can ask them at the end of the interview process. Practice your responses out loud or through mock interviews can improve confidence and clarity. Dress professionally and choose attire appropriate to the healthcare setting. Um, when you're going for an interview in healthcare, especially in the healthcare setting, you don't need to, especially with men, you don't need a three-piece suit and all that. A nice pair of slacks, nice shoes, a nice shirt. If you want to wear a tie, that's fine. Be more professional in your attire than a casual, but be comfortable as well. Women, you want to wear a nice skirt or a dress, be appropriate in the length of your skirt and dress. If you want to wear pants, make sure they're more of a professional looking part. Wear a nice blouse. Just be just look nice. Just be more um, saying that you want this job, that you're respectful of how you look out as well. First impressions matter. So arrive early. I try to arrive at an interview between the 15 minutes to 30 minutes before my the appointment. Um, so, and also you need to treat everyone with respect, including the front desk. Remember, the front desk is their face of that company, and they might even, when you leave after the interview process, they might even go to the receptionist and say, "How was they when they came in? Were they nice? Were they friendly?" If you was not nice or friendly to the receptionist, then you might not be getting into that position. So be careful. Remember the front desk, just like you would be the face of sterile processing, the front desk is the face of that company as well. So, and also after the interview, you want to send a thank you note or email. With sending the note or a thank you note or email, it keeps your name out there. It keeps your name up in the forefront of their minds too. This is a professional courtesy and reinforces your interest in the position. The promotions. These are often the results of strong performance. These are where people can demonstrate their leadership styles and their commitment to professional growth. They reflect an individual's ability to take on more complex responsibilities and contribute to a higher level within their department. To be considered for a promotion, it's important to fully understand the job descriptions for advanced roles and the qualifications they require. When you advance, even from a technician to a team lead, your responsibilities are going to be different. Even the way your coworkers will treat you is are going to be different because you've gone from being their coworker to being over them. So you got to think about stuff like that too. Also, with the promotions, they might even include additional certifications, your leadership skills, their experience in the specific departmental functions. Employees aiming for promotion should actively pursue opportunities for development, whether through continuing education, certification programs, or volunteering for projects. Seeking feedback and mentorship from supervisors can also provide valuable guidance. Uh, Promotions are not just about your tenure, they are about consistent, reliable performance and productive approach to learning and contributing to team success. Formal education. This is a very um, this is a very active key component of a professional development within our field. This is a structural educational program that deliver in-depth, systematic training and knowledge. And some of the examples that might be part of the formal education is associate's or bachelor's degree, any type of certifications from a technical school, and specialized sterile processing programs. All these offer um, will offer a broader understanding of healthcare, microbiology, infection control, and leadership skills that are highly valuable in advanced roles. Formal education is a prerequisite for promotions or specialized positions such as SPD educators, managers, and quality assurance contributors. Investing in formal education not only offers up career opportunities, but also build confidence and reinforces the technician's ability to perform duties safely, efficiently, and with a higher level of critical thinking. These are your objectives. Look them over. Remember, this is just what you get out of the chapter itself. There's no right or wrong answer. Your workbook, your exercises is on page 112. Your review quiz is on page 113. Please let me know what the scores are so I can update them in the appropriate manner. And again, my name is Corey Drinkett. My phone number is listed. You can text me or call me. I advise you that if you text me, please put down your name first, because if you don't, I'm not going to respond. And then I will add you to my phone, so that the next time you text or call, I know who I'm talking to. This is my email address. It's Corey.Drinkett. It should be all lowercase. I made the mistake there, but it's Corey.Drinkett@FranciscanAlliance.org. Email me if you have any questions, please. And I thank you for your time in reviewing chapter 5 with me. And have a good night. Thank you. Bye.